Hi, my name is Bailey, and this is going to be for the signature assignment for the Research and Evidence-Based Practice class. One change in healthcare practice that should be considered is the change related to postoperative pain management. Postoperative pain is a common and significant clinical problem experienced by patients following surgical procedures. The intensity and duration of postoperative pain can have major impact on patients' recovery, quality of life, and overall health outcomes. Available research suggests that effective pain management is crucial in the improving postoperative outcomes and reducing the risk for adverse events, such as prolonged hospital stays, increased risk for infections, impaired mobility. The use of evidence-based practices, such as the implementation of multimodal analgesic regimens and the use of patient-controlled analgesias, like PCAs, have shown to be effective in reducing the severity and the duration of the postoperative pain and improving patient outcomes. Other research has shown that patient education and involvement of pain management process can also be effective in reducing postoperative pain and improving patient outcomes. This may include providing patients with information about their pain, how it can be managed, and what can be expected during the postoperative period. Despite available evidence, there are still barriers of implementation of these practices of postoperative pain management, including inadequate staffing, lack of resources, limited access to pain management specialists, and so on. However, by overcoming these barriers and implementing evidence-based practices, healthcare providers can improve postoperative outcomes and reduce the impact of postoperative pain on patients. The proposal of change is the implementation of multimodal pain management approach. This approach improves the using of combination of different pain management techniques such as medication, physical therapy, psychosocial support, and providing comprehensive pain relief to patients. In traditional practice, pain management after surgery often relied heavy on the use of opioid medication, which can have serious side effects and carries the risk for addiction. By incorporating a variety of pain management techniques, a multimodal approach can help reduce the reliance on opioids and improve patient outcomes. Additionally, this approach can involve patient education, the improvement of pain management. Patients can be taught about different techniques available to them and encourage the active participation of these managements for their pain. This can also empower patients, increasing their sense of control and improve their overall recovery and satisfaction. Finally, implementing a multimodal pain management approach can also ensure that patients receive the most appropriate and effective treatment for the individual needs and circumstances. By tailoring the pain management plan to specific needs and preferences of each patient, healthcare providers can provide a more personalized and effective care. To operationalize the change proposal practice related to postoperative pain management and several steps that can be taken. These are some suggestions to consider. Assessing the current practices, such as conducting a thorough review of the current pain management practices in the selected practice and identify areas of improvement. Developing a detailed implementation plan. This is to include specific goals, objectives, timeline, budget, anything to specifically state for the success of the change. Training providers and staff, providing education and training to providers that focus on, postoperative care, and identifying multimodal pain management. This can include in-person training, online training, whichever would best suitify the situation. Incorporating patient education and involvement, developing educational materials, resources that patients can review that can help benefit their understanding on pain management and better understand their own care. This can include brochures, videos, communication tools, whichever is preferred. Implementation of the new protocols and procedures. So understanding that electronic health record systems may need to be edited, other sets or forms or checklists that are used, and monitoring and evaluating outcomes, so regularly tracking the outcomes of the changes made, patient satisfaction, and pain control. These steps can, of course, ensure the change in practice related to postoperative pain is effective. The diffusion of innovations theory can be used to guide the implementation of the proposed change in practice related to post-operative pain management. The diffusion of innovations theory reviews that the adoption of new practices, technologies, or ideas occur in a series of stages, including knowledge, decisions, implementation, and confirmation. The implementation of a new practice can can often face barriers, including resistance to change, lack of buy-in from stakeholders, and resource constraints. To overcome these barriers, there are a few strategies that can be used, such as address the resistance to change, proactively giving education, communication to the stakeholders or who's involved to show the change is, needed. Foster stakeholder buy-in, encouraging the stakeholders, including patients, providers, staff, to involved into the change and show the benefits from the change and their clear role in the implementation. Allocating sufficient resources. This is to make sure adequate resources are allocated for the implementation for the change, including the funding, staffing, and technology. Foster a culture of continuous improvement, showing that change can be impactful and overcoming the resistance to this change is based off of the evidence-based practices that are given. And lastly, monitoring and evaluating outcomes. Of course, we need to regularly check the outcomes that are happening with patient satisfaction, pain control, adverse events, and seeing if anything needs to be adjusted. There are several resources or sources of internal evidence that can be used to demonstrate the improvement of outcomes related to postoperative pain. These include patient satisfaction surveys, so in collecting regular surveys to see how patients are doing with their postoperative pain experience. Also seeing if a multimodal approach would be appropriate for this situation. Pain assessment data, so collecting and analyzing data based on the patient's self-reporting pain levels before and after the multimodal approaches have been given. Medication use data, so track and analyzing the data of pain medications that are given, including opioids, before and after the multimodal approach has been demonstrated, and seeing if there is another option that can be used instead of the opioid medication. Length of stay, seeing how long patients stay in the hospital after surgery and how long they've been there before to see if a multimodal approach will be appropriate. And adverse event data, so data on any adverse events that happened postoperatively, such as side effects that occur, possible addiction, anything that has been an adverse event from a multimodal approach, whether that's medication-based or not. These resources can help identify internal evidence and demonstrate the improvement of outcomes from postoperative pain management. So there are several ethical considerations that need to be taken into account when implementing change into this practice. First would be informed consent. Patients must be fully informed of the risks, benefits, alternatives to the change, and give their consent before undergoing any intervention. Pain management and patient autonomy. So the pain management should also respect the patient's preferences and making sure that the decisions are their own. Include giving patients opportunities to express their pain level and preferences of treatment so the multimodal approach can be adjusted to their specific needs. Confidentiality, the patient's medical information, personal data must be confidential, of course, because of HIPAA. Opioid use and addiction, the use of opioids and other pain medications should be carefully monitored to ensure that patients are not over-medicating and putting themselves at risk. And then resource allocation, so the implementation of a multimodal approach should be guided by principles and distributive for fairness, so everyone should get the same amount of care regardless of social economic status or like insurance coverage. And then to evaluate the outcomes from the change projected related to the postoperative pain management, there are several steps that can be taken, such as establishing evaluation metrics, establishing clear, measurable evaluation metrics aligned with the goals projected, collecting data that establishes an evaluation before and after the change has been implemented, and seeing if there's any information that can be adjusted. And this would include like the surveys mentioned, pain assessment data, medications used, and the length of stay. Conduct a formal evaluation just to see how the patients are handling the change, the employees, providers, everyone that's kind of involved. Feedback and continuous improvement would come from also the same patients, providers, staff, stakeholders to see if there's any improvement that needs to be made regarding the change. And then also just going over the findings that have contributed to the change with the stakeholders, healthcare providers, anyone involved that can contribute to widening the knowledge in this field to see if the change is appropriate. This disseminate findings from the change practice related to postoperative pain can help widen the knowledge of field in postoperative pain. So these can do like internal communication, so sharing the results with whether that's the providers, stakeholders, patients, for like meetings, presentations, and feedback sessions. Professional organization, so presenting the results to professional organizations and societies, nursing organizations, anything that can help spread awareness on this concern. Academic institutions, so help build evidence-based practices that can develop in academic institutions, and they can share the information moving forward. Policymakers, so the policies being made can contribute to effective approaches for postoperative pain management, and patient advocacy groups that would share information regarding their awareness on the situation, how their postoperative pain was managed, and empowering other patients to care for their own care and see that this change is important. By following these steps, healthcare providers can effectively disseminate the findings of their change project related to postoperative pain management, and relative stakeholders contribute to a wider knowledge in the field. This can help promote an uptake of the best practices in postoperative pain management and the improvement of patient outcomes. And that is it for the video. Of course, my references will be attached in the following submission. Thanks.